Good morning, everyone, and happy Friday. This is Karina Hill with the Florida Alcohol and Drug Abuse Association. And on behalf of the Florida Alcohol and Drug Abuse Association, we want to welcome you to today's webinar entitled Crisis Management and Response Within Treatment Settings with James Kowalsky. This webinar is being made available through a collaboration of the Florida Department of Children and Families Office of Substance Abuse and Mental Health and the Florida Alcohol and Drug Abuse Association. Please note that as an attendee, you are in listen-only mode and will only be able to view your name. If you have questions, please send them to the presenter and myself by using the Q&A panel. The button to open the panel is usually located on the upper right side of your monitor. Please use the Q&A panel to send any questions you may think of as you think of them, and the presenter will address them as time permits. Our audio is broadcast through the internet to your computer. If you experience poor computer audio, there are a few options to try on screen right now, and these options are posted in the chat panel too. If you continue to experience poor audio through your computer, try rejoining the webinar and call in using the telephone I will call in option. You must be connected to the audio of this presentation and view it on screen as well to receive a certificate of attendance. The recording and materials used in today's presentation will be available on the FADA website within 30 business days. One helpful hint is the archived video displays what looks like to be an error message, but it's only a delay buffer. Ignore it, hit play, and enjoy. To access the recording and PowerPoint, you will go to www.fada.org at Resource Center in the Training Library. FADA produces many webinars and workshops through the support of the Florida Department of Children and Families. To help participants track credits earned through attendance, we host an online community that provides a personalized digital journal where participants can maintain statements of credit for webinars and workshops taken through the Florida Alcohol and Drug Abuse Association. At the end of today's webinar, the web browser will direct everyone to an evaluation form on the FADA website. You will first need to register or sign in to your account to complete the evaluation. Information you provide FADA as part of registering remains confidential. Statements of credit will be posted within 5 business days after the evaluation closes in individual professional development journals for persons completing the evaluation and attending the full webinar. Completing the evaluation is necessary to receive CE credits or to access your statement of credit. Please note that the evaluation will close at midnight on Tuesday, April the 21st. 1 to 2 continuing education credits are available for participating in today's webinar. For persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, and Mental Health Counseling, and for persons credentialed through the Florida Certification Board. If you are a licensed healthcare practitioner, be sure to include your Florida license number for reporting to CE Broker when you register with our site for the first time. If you are certified with the Florida Certification Board or licensed outside of the state, you do not need to provide your certification number when you register with our site. Note, please, that WebEx monitors your arrival and departure of attendees and provides a report upon completion of the event. We are not permitted to provide contact hours or a certificate of attendance if you do not attend the entire webinar. We are not permitted to provide partial credit. And now I would like to present our presenter, James Kowalsky. He is the project director for the SAMHSA-funded PDO grant to prevent prescription drug and opioid overdose deaths at the Illinois Department of Human Services and the Division of Substance Use Prevention and Recovery. He serves as the Drug Overdose Prevention Program Coordinator and provides support to overdose education and distribution providers through the state of Illinois. Since 2013, James has been providing training and technical assistance to organizations adapting their practices to incorporate harm reduction, housing first, motivational interviewing, and trauma-informed care. James and his wife, Susie, provide training and consultation through their company, Practice for Progress. James is a member of the Motivational Interviewing Network of Trainers. He received a Master's of Arts degree from the School of Social Service Administration at the University of Chicago. James is committed to promoting a shift in public policy and service delivery that is characterized by acceptance and respect for people who use drugs, have a substance use disorder, or are in recovery. And James, we thank you for joining us today, and we look forward to your presentation, and I will be turning that over to you now.
Great, thanks so much, Karina. Can everyone hear me okay? All right. If you do have any problems hearing me at any point, just go ahead and let me know in the either the Q&A box, chat box that's over there on the right side of your screen. So yes, today we're going to be talking about crisis management and response within treatment settings. So I want to just, well, I kind of got a pretty good introduction from Karina already, so I'll just show you my contact information here. Feel free to reach out to me if you're viewing this training today or in the future and you have any additional questions, or if you'd like to learn more about my wife and I's business, Practice for Progress, and some of the other trainings that we offer, you can go to our website. The link is down there. I do also want to just take an opportunity here at the beginning to just say thank you to everyone. Thank you for joining this webinar today. But more importantly, obviously with coronavirus and everything that's happening with it, a lot of people have had to make a lot of changes to the ways they usually deliver services. And I know up here in Illinois, in particular, we have folks who are offering in-person services maybe on a limited basis, or are having to make modifications to keep everyone safe, who are experimenting and doing more telehealth or group counseling by Zoom meetings, or offering virtual recovery options. And so I really do want to just take a second to say thank you to everyone. I don't think that substance use treatment professionals are the ones that necessarily get thanked on the nightly news, but I do recognize and realize that you all are still doing very essential work in these times. And, just because we are dealing with this pandemic right now, it doesn't mean that people's problems and challenges with substance use have gone away. And so I really do feel like your work is just more important now than it ever has been. And so I just want to say I'm very grateful for what you all are doing every day. So hopefully today's training will give us some additional insights into working with people when they're experiencing a crisis, and kind of how we help them manage and work through those situations. I will move us forward. So here are some of the objectives that we have for today. So we're going to be describing the types of crises that are commonly experienced by individuals with substance use disorders, identifying the role of recognizing and separating treatment providers' own emotions from the crisis. And so this is a lot of what we're going to focus on in the first half is really how do we bring our own awareness to ourselves and what impact that we're having in the midst of a crisis. I think we know that we want to respond in a way that's helpful, but I think what that really starts with, and what we'll talk a lot about, is how being aware of how we're feeling and what we're projecting out as well are really important elements of managing a crisis. And then last, we'll be exploring the ways that treatment teams can effectively plan for managing crises when they arise. And this is another key theme that we'll kind of come back to, is how important planning is. That working with a crisis is a lot more challenging when we're working in that specific moment and trying to make all of our decisions on the fly, as opposed to having a plan in place, having kind of the background knowledge, not only of our teammates, but also of each other. And making sure that we know not only what our plan is as a team, but also for our participants or the clients that we're serving, what's going to be most helpful for them in those moments. So if you haven't seen the chat feature, the Q&A feature over there on the side, I do like to try to get people to use it a little bit throughout the training, so I'll ask a few questions here and there. We obviously don't have time to go around and do introductions with everybody, But I would just like you to think about, and then if anybody feels comfortable doing so, to respond in the chat box to this question. So what is one of your concerns about managing a crisis? I'll give you a second to think about that and maybe type some responses in. So yeah, one person put our own mental well-being while providing services to others who are struggling. I think that's definitely a pretty common concern that people experience. In particular, not only for our own mental well-being, but sort of staff in general, right? So I think we recognize that working very closely with people who are going through a crisis takes a toll on us and on staff who are kind of around and being exposed. So how do we try to, I would say, ensure the safety of staff, not only physically, obviously, but also mentally, making sure that staff are well cared for as they do this really challenging work. Yeah, thanks for that, Cassandra.
We have a couple others, James. Lack of physical contact and dealing with suicidal responses, having to call the police.
Right, having to call the police. And I think probably a lot of us are aware that police in some situations, and we'll actually talk about this towards the end, about like kind of some of the circumstances where we might want to call the police and how to navigate that. But I think having to call the police is a very stressful situation because we know while the police in the right circumstances can be extremely helpful, they can also definitely escalate a situation, because a person may have had bad experiences with police in the past. Anything like that might be really challenging. I think some of the other things that I'm seeing on here are, dealing with suicidal ideation and domestic violence, and limited resources. And I think limited resources are something that, and obviously is kind of being exacerbated in some cases because of the current coronavirus that we're going through. Limited resources, I think, is something that we're always dealing with in, treatment programs and treatment settings. But I think those kinds of things feel especially, exacerbated by a crisis situation, right? Those are the moments where you really wish you had all the answers or all the resources that a person could need. Just looking through some of the other responses. And yeah, and again, the question about police came up again. I see someone else mention that, and having to determine if a patient needs to be Baker acted. And I think what I will just say sort of as a kind of disclaimer for today's training is we're not going to go into extreme details about, what we usually refer to up here in Illinois as petitioning someone, but basically, mandating a hospitalization, that whole process. We'll touch on some of the themes related to it, but I think that in itself sort of deserves its own training, and I think is a real challenge to sort of determine, and in what situations is that necessary, or in what situations is that overstepping? And so I will just name for myself, one of the concerns that I have about managing a crisis that this makes me think of is, taking away people's autonomy. And we talk so much in treatment about how important it is for people to make their own decisions, how people have to choose things for themselves, and that's how they get real meaning out of it. And when we talk about something like hospitalizing someone or using a Baker Act against someone or contacting the police, very often those are situations where we're actually taking agency away from the person, where we're saying, you can't make this decision for yourself, so I'm going to make it for you on behalf of your safety. And I think that's for me, that's sort of my concern is, does taking autonomy away from that person damage the therapeutic relationship? And so under what circumstances are we going to take away autonomy? And we just want to be really careful with how we do that. Just looking through. Not being prepared in general, I think, is a really important thing, and we'll kind of come back to that. And I'm looking through, so concerned about financial pressure, not being able to pay rent, healthy coping mechanisms. Yeah, so I think all of these are, some of the challenges that we see people facing. And I think in a crisis, to me, I think of a lot of the risk to the individual is that the crisis causes the person to pull away or to lose their sources of support, or to, instead of engaging in healthy coping mechanisms, to move towards less healthy coping mechanisms. Sort of some of the things that are coming up for me there. And I think the other thing, as I see some of the other comments here about, when to involve either DCFS or police, hopefully we're in a situation that allows us to work through these crises as a team. And I think that's a really important thing to come back to, is working together as a team. But at the same time, there are situations where we might end up having to make a decision on our own. And I think that can be really intimidating. So thank you to all of you for the comments and for the great examples you're sharing here. I do just want to say, it is so important that we name some of our concerns about managing a crisis, that we normalize it. We are worried about things that might come up in a crisis, and it's okay to say that. And I think it's actually important for us to say that to each other. I think sometimes, especially like when a new staff member comes on, there's sort of this pressure to just sort of know your way around, to know how to handle all these things and how to navigate these really complicated situations. And I think whether we're brand new at a program or whether we've been there for a while, it's hard to say that we wouldn't know what to do if, one of these situations arise, one of these types of crisis situations. And so I think it really helped us build a sense of community around crisis and a shared commitment to working together, if we're able to start from a place of naming what our concerns are, and then working from there to say, how are we as a team going to make sure we handle this in the most effective way possible? So here are some of the challenging situations facing people in treatment and recovery, and actually several of these came up just in the comments that you all offered previously. So some of the things we see on here are mental health problems, and so that could be something acute like suicidal ideation, or it could be kind of ongoing mental health concerns, ongoing depression, anxiety, mania, psychosis. All of these are things that kind of can exacerbate people's mental health or kind of exacerbate the stress that people feel in their lives. Obviously trauma, and that could be current trauma that someone's experiencing or a history of trauma, physical health comorbidities, so complex health problems. Risky behaviors, obviously a lot of the people who are coming are engaged or have been engaged in substance use, which is itself a risky behavior. Family instability, so do people have a support network? Do they have meaningful relationships in their lives, or are those sort of up in the air and kind of always on unsteady ground? As far as employment goes, we mentioned the idea, and this feeds into the next point about unstable housing. Someone mentioned, the concern and the pressure, financial pressures about being able to keep up with rent. A lot of the folks who are, going to be in substance use treatment are working on very thin margins, like many people are, in fact. And so that creates a massive amount of stress around, employment and keeping up with employment. And then when you add on top of that, I know, for instance, like when I've worked in treatment programs, you have people who are trying to attend an IOP program, and they're coming for, they're coming 4 days a week for treatment. And then they're trying to fit in a full-time work schedule on top of that. We had folks who were working night shifts at their jobs, or they're working 11 p.m. to 7 a.m. just so that they can keep up with both their employment obligations and keeping their bills paid, and also making it to treatment as much as they're supposed to be. So I think all of those are some really common and really challenging situations that people face. All of these things, that I mentioned here, these are all different risk factors for a crisis. And what I will say is, unlike some other crisis that we might sort of plan for instance, like you probably know where the fire extinguisher is, or you might do a fire drill at your office every so often. Fires are not an inherent part of your job, but these situations are. Working with people who are experiencing and going through these things, this is part of what your job requires of you. And so there really is, a need to figure out not only how to work with people around these situations, but also the crises that these situations might precipitate. So, when you're working with someone who's going through any of these situations and understanding that these are risk factors, you really want to pay attention to how they're managing them so that they don't become a crisis. And especially if you know they're dealing with multiple of these situations at the same time, you want to be really attentive to kind of how they're doing with balancing and managing those demands on them. So this is kind of a broad overview here, the different functions and kind of processes involved in crisis management. What I will say is, as far as, so I guess, obviously the overall goal here, focusing on minimizing risk and maximizing safety. What I want to say though about, doing an ongoing risk assessment of the individual served, this is where I was saying the work on the front end is so important. It's really important that we know the person that we're working with, because that's going to give us information that we really need in order to be able to assess what is happening in that moment. So, for some people, one behavior might be indicative of a crisis and a high level of risk, while another person might just be at their baseline. And this can be in simple things, just in sort of, the volume and the tone that someone speaks at. So someone might seem really angry or really upset, but that also might just be a normal way of communicating to them. Someone might seem like they are engaging in really chaotic substance use, but actually that's closer to their baseline. Someone might, I think this comes up a lot with suicidal ideation, where there are some folks who experience depression to an extent where some level of suicidal ideation is pretty normal for them. It doesn't mean that they're planning on acting on it or that they are kind of taking steps towards that in that moment, but the fact that those thoughts accompany them might just be a symptom of their depression. And so knowing that person really well and knowing the fluctuations in their levels of suicidal ideation or their substance use might help us better understand and complete an accurate risk assessment about the person that we're serving in that moment. When we talk about the assessment of the environment, I think part of that is the risk factors we were just talking on. So, the idea that there are both risk and protective factors in the environment. So we want to be aware of what their environment includes kind of in the broader sense, but also in the immediate environment is what we're talking about in a crisis. So the physical space that we're in that moment. So I think the other thing is just, you see here timely and effective responses, but also post-crisis follow-up and recovery intervention. I say there's sort of work on the front end of a crisis. I think there's also work on the back end of a crisis that we need to be doing. Our role doesn't end when the crisis is over. And so following up afterwards is a really important part of both kind of managing the crisis, but also establishing safety moving forward. So, a common debrief might be talking about, and we'll get into more of this later too as well, but what happened, how did we handle it, and then what can we do differently, or what should we do differently in the future? So, we want to kind of take those questions into consideration after we're managing a crisis and once we've reached a kind of point of calm. Here we see preparing for the unexpected. And again, so coming back to this idea of like the work on the front end. So I really like this expression. I think we've all heard, strike while the iron's hot. In this instance, we're actually trying to strike when the iron is cold. And the reason that we do that is, what I've said already is the idea that it's a lot easier to handle and navigate a crisis or come up with plans for how to manage a crisis when there's not actually a crisis ongoing in that moment. So that's something we want to take into consideration. I will also say, though, this is not an individual responsibility. It really needs to be happening across all levels. And so, I think of like the example of like the fire or like the emergency procedures. Very often, crisis management is something that, we get tossed a stack of papers. It's not a conversation that's ongoing. It's sort of something that someone wrote down a while ago, like, oh, if there's a crisis happening, here's what we do. And someone just throws the manual at you and you're supposed to read through it and then you'll be prepared. And I don't necessarily think that that's an effective way of preparing for a crisis situation. And it actually requires everyone sort of working together, talking, reestablishing plans as new people come on, whether that's, new teammates or interns, whoever is working in the office. But I think those things need to be kind of regular conversations that are happening across all levels. And so when it comes to being prepared for a crisis, I think some of the things that we might do, just talking about the nuts and bolts. So several people mentioned on here, calling the police, Baker Act, I think those are important conversations to have with your team about, what are the nuts and bolts of an involuntary hospitalization, and not only under what circumstances would we pursue calling 911 as an organization, but also, at what point should I contact my supervisor as opposed to calling 911? At what point would I actually start filling out paperwork and petitioning this person? And sort of having a clear sense amongst yourselves. And I think this will vary a lot organization to organization, but I think having a clear sense amongst yourselves about sort of where it is that you all fall on this. So what I will also say is this, striking while the iron is cold is also extremely important for the people that we're working with. So, it should not just be something that we're doing with our teammates, but I think there's a lot of, this is sort of, the work on the front end that we can do. And I think a lot of these questions that you see in here, these are all things that actually go really well with doing kind of relapse prevention work as well. So some of these questions actually might seem familiar to you for that reason. What situations lead to my stress? What can I do for myself to regularly reduce distress? So those are some of the questions that we can ask someone. And I think this is actually a template, and probably you all maybe use some of these questions in your assessment, or maybe these are things that could be added in. All of these, I think, are really useful questions for just getting a clear sense of someone, of understanding them, of understanding what might signal that they are approaching a crisis, of what might signal that they've kind of, that they're in a place where they really need to come back and they really need some help with that. And so when it comes to doing one of these crisis recovery plans, I think especially if you're going to kind of use this as a template, this is a really effective tool to use early on with people. And while you might start from these stems or start from these questions, it's really important that if you're working on this with somebody that you, write it down together, but that you also use the language that the person is naming to you, right? So, while the template might be there, we want them to sort of fill in the blanks within their own words. And so I guess, something to think about now is, when you're doing your assessment to people, then I know probably your assessments vary a lot in terms of length and how much information you have to get in them, and I think that can be a real challenge. But when you're doing your assessments, what types of things are you asking people about when you start working with them? I think one of the, to me, like going back to that question of like, what are your concerns about managing a crisis is, one of the concerns about managing a crisis is that you haven't done this work in advance, right? So, and I think when someone's brand new and it looks like they're experiencing a crisis and we don't have all of this information to work with, we don't know, what are their cues, what are their triggers, what are the things that might help them in that moment to calm down and feel grounded again. When we don't have that base of information to work with, I think that makes managing a crisis that much more challenging. And I think, again, sorry, I'll just mention before I move on here, this is also something that you can revisit after a crisis. So we talked about debriefing a moment ago, and I think the crisis recovery plan is also something you can debrief. You can say, this is the situation, this is what happened, here are some of the things that you identified that we could do to help you in this type of a crisis. How was that for you, right? Trying to get people's own feedback about the crisis and how we did in managing it. So a lot of what I'm going to go into now actually comes from a model of crisis management that's called therapeutic crisis intervention. And that was actually originally designed for working with young people, but it's also been adapted and applied to working with adults. And so what you'll see here is, crisis management really does begin with an awareness of ourselves and, knowing what's going on with us, knowing how we can manage our own stuff, so that we can think clearly and make effective decisions to sort of manage a crisis in that moment. So that self-awareness is a really important piece. And recognizing that, we can have a really big influence on what happens in a crisis situation. And as someone else mentioned, that we ourselves are then affected by what's happening in that crisis. So the questions we ask ourselves, to sort of develop a crisis awareness are these 4 questions. So, when you're in this crisis situation or things are getting tense and escalating, You want to try to slow things down as much as possible and think to yourself, notice what you are feeling. What am I feeling now? How might this person feel? What's happening in the environment around us, and how do I best respond? Now, these are questions that oftentimes we have to think about and answer very quickly. So I think it's kind of important that we develop a familiarity and kind of, feel comfortable asking these questions. I also know that it's a little bit cheesy, but there's sort of like the hand gestures that go along with these. So, what am I feeling now? You point at yourself. How might this person feel? You point across from you. How's the environment? You make a circle around you. And then how do I best respond, right? Coming back out from you, with your response. You're holding your hands out with your response. So we're going to kind of work our way through these questions now. So question one is, what am I feeling now? And the idea of self-awareness. Self-awareness, I think oftentimes we think about self-awareness as being a completely internal process, about being aware of everything that we're feeling and kind of what's happening on the inside. But I also think it's really important that we sort of recognize the other side of self-awareness, which is being aware of how our perceptions, how our beliefs, how our thoughts and actions are actually influencing our interactions with other people. So, what is it that I'm feeling and how is that coming to play in this situation? And so being able to sort of notice in that moment, what essentially what's happening on the inside for us, how that's coming out in our engagements with the folks we're working with. So I think something to keep in mind about awareness is it doesn't always feel good to, no matter how prepared you feel or how many protocols you have in place, it's not going to necessarily feel good to manage a crisis. And even when you're making what's probably the right decision in that moment, that doesn't mean that it's going to feel good. So I know, even when so I used to work in community mental health for many years. And so there were several times where I brought people to the hospital who were experiencing suicidal ideation. And even when that person, seemed to have some acceptance or seemed to sort of be on board with the idea of the hospitalization, it's still stressful. It's still, the idea of bringing someone into a hospital setting and sort of the risks that are associated there and the uncertainty of being in a hospital and not knowing how long you're going to stay there and not knowing how it's going to turn out. And just, there's a leap that you have to make where, based on all the information you have, this seems like the best option for this person. And if you obviously have their buy-in, that makes it feel a little bit better. But I think it still can affect you in ways where you feel, uncertain, you feel kind of shaky, you feel tense. And again, I think maybe I'm sort of speaking from my own experience here, but I think that's my experience in those situations. And I think just being aware of not only how we're feeling in that moment, but how we might feel or how we have felt when we've experienced those encounters in the past. So yes, I think, some of the other points on here, and I've sort of touched on these a little bit, but just when we are self-aware, we're better able to sort of be mindful of our emotions, control the ways that we're projecting out what we're feeling, and make sure that we're engaging and communicating in an effective way. So I want to just share a quick metaphor, analogy. But so the metaphor of the cup. And so Matt Bennett is a great trainer and speaker. He does a lot of work around trauma specifically. So if you all are interested in learning more, I would really encourage checking out Matt's blog. He also does a podcast specifically about trauma-informed care. So there's a lot of really good resources that he offers. So you can find all that. I believe the link is in the references section. But one of the things that Matt has spoken about is this idea of how do we manage our cup. So we all have cups. And the water that fills them up are the stressful things that are happening throughout our day. And I think, especially when we're facing a global pandemic and, trying to navigate all the changes in our lives and making extra safety precautions and limiting our trips to the grocery store, for all of us, I think our cups are a little bit more filled with that stress, with that water right now than they are under other circumstances. And when that cup gets totally filled up is when we run out of patience and we start to get really irritable, or, you know, we act out, we snap at people. We're just not totally ourselves, you know, when the cup is filled with water. And so as a treatment provider, part of our role is to help take some of the water out of our clients' cups. So that then helps them sort of figure out, and I think also help them figure out strategies to sort of manage their own water levels in their cups, if that's helpful. So sort of the coping mechanisms, the strategies that we might work on with people and learn with people, those kind of help take the water out of people's cups as well. And being mindful that we can adjust those water levels, I think, is really useful. And I think, well, the other thing I'll say is, much like we kind of do that for our clients, I think we can also help do that for each other. So I know for me, you know, when I've had really stressful interactions with clients, going and talking to my coworker about it afterwards and just sort of playing it over again is one way that I've found really helps me kind of calm down and let some of the water back out of my cup. So talking to coworkers, talking to supervisors, so making use of those types of resources, I think are some of the ways that we, you know, manage our cups, if you will. And obviously, like, you know, we can't control everything that happens in our client's day. Like I mentioned, you know, some clients would come in and they've just gotten off work. They worked 8 hours. They haven't slept yet. They're exhausted. You know, they're worried about their kid that's not doing as well in school as they'd like, or they've got some, you know, court date pending, and then that's filling up their cups. So a lot of the things that are happening with our clients' cups are really out of our control. But what we can do is when they come in and when they bring their cups into our programs, you know, we can manage our responses to them. And I think our responses can really make a big difference there. So I guess, you know, one question I have for you all is, in terms of your own cup, what would you say are some things that help you notice that your cup is full? What would be signs that you feel like for you that your cup is full right now? You can go ahead and respond in the chat box there. Someone said getting easily annoyed as like a good example. I like that. Lacking compassion, stress reducing your sleep. So that's interesting. I think also just kind of being easily distracted. So some of this might actually happen when we're at our job, and some of it might happen when we're at home also. And so I think that's really important, is kind of the things that are filling up our cup at work can also kind of come home with us. Someone actually mentioned here the idea of dreading going to work. And I think that's definitely like a really big sign that our cup is sort of over full right now, and that we need to find some ways of sort of managing it. And then I guess sort of the flip side of that is, you know, what are some of the things you do when you start to notice these things? When you feel yourself, you know, being stressed out, anxious, not able to sleep well, you know, dreading going to work, what are some of the things that you do that sort of help you manage, or maybe take some of that water back out of your cup? Taking a day off for self-care. You know, I think going back to this idea of like having to feel so tough that we can just sort of take on anything and not even have to talk about a crisis, we'll just know what to do when it comes along. I think taking time off and using our vacation days in some ways can sort of feel like a badge of pride, like I never take time off, I don't even have to. But I think taking time off is something that's really important to help us recharge. Some other folks mentioned here, you know, exercising, so running and yoga or cooking, singing at the top of your lungs. Yes, love it. Yeah, so those kinds of things can be really helpful. I think What else do we have on here? So reviewing the events that led to my current state and trying to process them. I think that's really important, right, is trying to figure out. And I think especially if you notice things like being short with people, you know, kind of getting to that place where your cup is really full, noticing, for me, you know, the way it always came up for me is I was like, this isn't normal for me. I know that normally I'm a really good listener and I can be really patient with people. But when my cup is full, I find myself just like, come on, let's go, let's get this over with, just get to the point, right? And so when you start to notice something like that, kind of taking a step back and saying like, well, why am I feeling this way? I think that's a really healthy strategy there. Someone mentioned prayer, watching funny movies, going for walks. I think practicing self-compassion. I think that's also a really great idea, right? Of just being able to say to yourself like, hey, it is okay for me to feel this way right now. My job is hard. This work doesn't come that easily. And so it's important that we are able to sort of, you know, be gentle with ourselves, I think, and be mindful of that. Thanks. You all are great. I really appreciate it. I so enjoy doing webinars when people actually engage in the chat and the Q&A. And so it's really helpful to see all these comments coming in. And I think helpful for, you know, even if you're not commenting in the comment box, to be thinking about sort of this stuff, you know, what are my signs that my cup is full and what can I do to help take some of the water out of that? Oh, animals are a source of relaxation as a companion. Yes. You know, we have 2 dogs ourselves. They're cute, they're fluffy. They're always happy when you come home. Happy to cuddle with you, so great companionship from pets also. I think probably a lot of us are familiar with the HALT acronym. I've probably heard this one before. I think this is pretty common in treatment circles. You know, am I hungry? Am I angry? Am I lonely? Am I tired? So hungry, angry, lonely, tired. And so these are things that might point to the need for some type of self-care. And I think we can all think very easily about how any of these might be contributing to being really stressed. And maybe it's that we're, you know, not taking good care of ourselves, not eating enough, skipping meals, just being kind of short-tempered with people. And so I think those are some of the signs that, and when we're saying, you know, how do we figure out or take a step back and say, okay, I notice myself, you know, acting in a way where it seems like my cup is just so full right now. These are some of the things that might be underpinning it and are, I think, essential components of good self-care, which is, you know, making sure that you're eating well, that you are finding, you know, time to get good rest, but also that you're finding connection with people. And I think, you know, we talk so much in recovery and in treatment programs about the need for meaningful relationships in people's lives. And I think, you know, we really can't take that for granted in our own lives as well. That coming home and being able to have like a good conversation with someone who we care about, with a family member, with a friend, or, you know, spiritual leader, whoever it might be, that those are really important parts of kind of helping us maintain being in a good place for the work that we're doing. I also want to just share this real quick. For those of you who aren't familiar, Trauma Stewardship is a book by Burke and Vandernoot Lipsky. I'm not sure how. Anyway, if you all aren't familiar with the book, it's a great book, and I know that you know, I've come back to this book several times, and whenever I'm reading it, I think anybody who works in some sort of helping profession can read this and sort of feel very, very well understood. You know, if you want to read something where you're like, oh, this person gets it, they understand how hard it is. So I think the trauma exposure response is one of the things that they talk about in the book. But anyway, so I won't go on too much. But yes, Trauma Stewardship is the book, and you know, caring for self while caring for others is the I think subtitle there. But so one of the things they talk about is sort of, these are sort of going back to that question of what are some of the signs, and some of you all touched on some of these as well. Some of the signs that our cup might be full, or things that might be coming up for us. And these are pretty common things that might just be a response to trauma and the regular exposure to trauma in our work. So you see here, like, you know, feeling angry. I think, you know, a sense that one can never do enough for me is really a significant one that would come up a lot. Just this idea of, so often when you're doing this work, there's just so much to do, and there's always more you can be doing. And so I think it's easy to get kind of beaten down by that. Some of the other ones you see on here are sort of, inability to listen. Someone mentioned kind of being distracted, and so I think that's another good example of that. So coming back to, this list, as well as the hungry, angry, lonely, tired, the HALT acronym, these are some of the things to be mindful of, and to sort of, as we're paying attention to ourselves, to sort of notice and to take as signs that, we might need to do something to sort of ground ourselves and to bring ourselves back so that we're better able to handle a crisis when it comes up. I'll also just mention, one way of sort of thinking about how we are feeling ourselves is to think about sort of on this spectrum of caution, the idea of, to one extreme is hypervigilance, and that's where we're, kind of constantly on edge, extremely worried. We might sort of think that there's a crisis there when there's not. So that's sort of the hypervigilance. And dissociation is when we're so laid back and so, oh, I've seen this a million times before. This is nothing to worry about, right? Dissociation is like you're not even affected. And I think if you're too far on either side of this spectrum, if your feelings are too far on either side of the spectrum, you're not going to be able to properly handle a crisis. So, if you're hypervigilant, you might overreact to the crisis. If you're dissociating, then you might not react at all. You might not even realize that a crisis is happening. So really what we're striving for is to be somewhere in the middle here, to strike a balance and to approach things with caution. And what does caution look like? It, I think, means being, aware and alert, but not scared. So I think that's sort of a helpful way to think of where we're falling on this continuum. And I think, so some things to keep in mind is, as we're asking ourselves, like, what am I feeling in this moment, to sort of think, where am I falling on this? Am I properly attuned to what's going on? Am I aware of what's happening? Or am I feeling a little bit too on edge, or am I feeling a little bit too disconnected? And again, if you're feeling hypervigilant, what can I do to sort of like calm myself down in this moment and be able to like better respond and manage this crisis? And so I've seen people do things like, obviously, breathing techniques and that sort of stuff in the moment. Some people might pause the situation so that they can take a quick break. I think taking a bathroom break is always like depending on the situation. Obviously, if you're in a safety situation, you can't just be like, hey, I'm going to go run to the bathroom real quick. But if you notice things getting tense and escalating, like asking to take a quick moment, to take a break. So I think kind of finding ways to calm and soothe. And I think there are ways, even if you're not able to walk away from the situation in the moment, to sort of help calm yourself and ground yourself. And I think thinking about what that might look like for you. And then I think, I think in general, we might, so I will say, like, for me, I know that I lean more in a crisis situation to dissociation, where I think I'm more prone to dissociation because I'm trying to project such a level of calm that it almost doesn't allow me to be as like cautious as I need to be. And I think knowing for yourself, do I lean more towards the hypervigilance or the dissociation, and how do I balance that, I think is important work to do both before and after a crisis situation. So question 2, how might this person feel? Oh, sorry. So when we talk about, how might someone feel, I like to use the example of the iceberg, right? So what the behavior someone's presenting with, the words that they're saying, the actions that they're taking, that's sort of like the tip of the iceberg that we're seeing. And what we know very often from working with people is that there's actually a lot of stuff that's happening underneath the surface, right? Feelings that person has, needs that they're expressing with this behavior, and they might not be using their words to express a specific need, but their actions might be expressing it. And so I think that's a really key idea is, understanding what a person feels requires more than just looking at what they're showing us in that moment, but also trying to do some interpretation and understanding what's happening underneath the surface. So some things that I think can be helpful to keep in mind. And again, I think there's sort of like work on the front end about this is, knowing what kind of experiences that person has had before, what types of strategies they've developed for kind of getting their needs met in the past. And so I think, knowing what are their coping skills maybe that they've used and knowing what might be the alternatives. And so I think that's where kind of talking about someone's long-term goals come in, about like how they have handled situations in the past and how they want to handle them in the future. And so I think that's where it's really important that we're attuned to what people want to get, both, in general from treatment, but also trying to pay attention when someone comes in and they're, raging at us, to like understand what it is underneath the surface that's got them so upset, or that's got them really looking for some kind of help from us. And I think that's a helpful thing to keep in mind is, even when someone's extremely upset with us, part of what they're feeling or what they're showing us when they're coming and expressing that anger at us or at our program is underneath the surface, they think they can get some kind of help there, right? They wouldn't bother coming in and being upset with you if they didn't feel like there was something they could get out of being there. And so I think that's a really important thing to try to hopefully help us, stay present in the moment and try to be as helpful as possible. I think, we also want to kind of, and I think this is another place where using our own self-awareness can come into play. So noticing what you're feeling in a moment might help you guess or, figure out what is happening for that person as well. So, I have had people, like in a group, someone who shares something really personal, and the other group members don't necessarily respond in the most helpful way. Maybe they snicker, or they seem to sort of like be passing judgment on the choices that person made. And, you can sort of feel yourself, or I know I can feel myself in that moment, feeling defensive or feeling angry with those group members for not being more supportive of this person who's being really vulnerable. And then that person, I'm actually thinking of one particular situation, and then that person sort of snapped at everybody in the group and walked out and left the group before the break came. And, I remember talking to her during the break and kind of helping her come back to the group after that. But, not surprisingly, what she was talking about was, everything that I was feeling in that moment, I think she was feeling also to some extent, right? She felt embarrassed. She felt pissed off at these people for not being more supportive of her. And so I think sometimes what we're feeling, and again, our own self-awareness helps us understand what that other person might be feeling in that situation as well. And it doesn't mean that we're always going to feel the same thing as the folks we're working with, but I think it might give us some clues. And the other thing is, going back to this idea of trauma being present in people's lives, and I think especially for a lot of people's substance use trajectory, trauma often plays a role in sort of when substance use escalated. But trauma, beyond just, impacting people's substance use, it can have very deep impacts on people's behavior, on the way that they think about things, on the feelings that they have. And so, again, when we're looking at people's behaviors, I think it's important that we use sort of this trauma lens, and we try to think about how might, this as a behavior, this as a strategy for getting your needs met, how might this make sense if you were someone who had experienced trauma in your life? Some of the things that we might see from people are sort of nonverbal communication. And so this like pie chart, this study was basically saying that so much of what we communicate actually doesn't come in the words that we use. And again, this speaks to what's happening underneath the surface. It's actually in sort of the body language that we're expressing with, or the tone of voice that we're using. And so there's a lot of nonverbal communication, a lot of things that we might sort of see presented that actually might indicate something that's happening underneath the surface. So silence, I think, is a really important one, right? When people sort of withdraw and stop speaking or stop sharing. Different facial expressions, obviously faces are very expressive, give us a lot of information. Things like, eye contact, and when we lose eye contact with people, minimal encourages, those are things like, when people are saying, right? So those types of nonverbal forms of communication we want to be attentive to. So remember, kind of what's happening above the surface is more than just the words and the behaviors we're seeing. It's almost, you know, in some ways it's what we're not seeing, or what are kind of the more subtle signs that we're seeing as well. Some of the more overt signs, I guess you could say, of what we see on the surface that help us guess at what someone's feeling. So these are sort of, you know, when pain is showing up on the surface. So you'll see things like outbursts from people, physical or verbal aggression, when people start becoming threatening either with staff or with participants. And I think, you know, this is something else where, you know, in a crisis situation, I start to get worried that if we don't intervene properly in a crisis situation, we might have no other choice but to disconnect someone from services. And so I think that was something that I was often worried about, is as people would be escalating, helping them understand where the line is, right? So you can say that you hate your counselor. You can say that you think they're not really there to help you. You can say that they're just there to get a paycheck. You cannot say that you are planning to hurt someone or that you are going to like do something to physically harm either a staff member or someone else who's in services with you. And I think making very clear, and again, this is drawing that line, I think, is an important line to make at the beginning, right? Again, striking while the iron's cold, not when someone's escalated and yelling at you. You can maybe remind them gently of it at that time. But I think putting that on people's radar and having that be part of the ground rules that you set with them is really important. So, you know, another sign we might see on the surface, though, is complete disengagement from services. So when people pull away entirely from services, and I think, you know, sometimes people disengage from services because they're ready, because they're, you know, feel like they've gotten what they need to get. But I think we also know that a lot of times people will disengage from services, and particularly when people are mandated, it's very concerning when people stop showing up. Like, hey, I know you were really concerned with, you know, beating this charge and getting off probation and showing up to treatment as much as you needed to, and you haven't been coming around as much. So these are some of the ways that we might see, you know, discontent or frustration kind of boiling over into sort of what feels like a crisis situation, is when people pull away entirely. And then some other things you might see: self-injury, people actually self-harming themselves, defiance of staff, and trauma reenactment, so actually reenacting elements of their trauma. And sometimes that can look like trying to victimize other people because of something that happened to them. Looking around at the environment, a couple of quick notes here. So I think one of the most important things that we think about, like, are there other people around? So I always think about an audience and what impact that makes. I think that's a more obvious one, but also things like, you know, is the space disorganized and messy? You know, stress can kind of be exacerbated, or it can be harder to concentrate when you're in a messy space. So I'm sure some of us have had that experience of when we're feeling disorganized, right? One of the things that helps is, let me just organize my space. Or, right, you have work to do. You're like, let me just, you know, do a load of laundry and clean up the house real quick, and then I'll feel better. And there actually is something to that, I think, of having a space where you feel calm, where it doesn't feel kind of chaotic. And so I think that can come into play in subtle ways when we're, you know, assessing the environment. We want to make sure we make our environment as peaceful as possible. I was actually in a treatment program downstate in Illinois a couple months ago, and honestly, I walked into the space and it almost felt like walking into a spa. I was like, this is a really beautiful, like, there was big, beautiful photography of nature on the walls. There were these big, comfy couches in the waiting room. There was one of those misters blowing the essential oils, so it smelled really nice in there. It's like, wow, I felt calmer just walking into this space. And so that was one of those situations where I thought, this is the kind of physical environment that really promotes well-being in a lot of different ways. And then I think other things like, you know, temperature and lighting and noise levels, those are all different things that can kind of contribute to how someone feels in a physical environment. And then other things we think about are like points of exit. So, you know, being mindful of essentially your escape route from a situation. If you needed to leave suddenly, would you be able to get to the door very easily and move out of that situation if needed? Here's a quote from Judith Herman that I like. She wrote the book Trauma and Recovery, but trauma robs the victim of a sense of power and control. The guiding principle of recovery is to restore power and control to the survivor. The first task of recovery is to establish the survivor's safety. And I think this can be, really challenging for us, but I think is an important part of our work is how do we make sure that when someone comes into our space that they feel safe? And I think some of the things we've touched on already, like establishing those ground rules, like when you are here, people cannot talk to you or treat you in this way or that way, right? And, some of these things we gloss over, right? We're signing a, notice of patient rights and, you're not going to be discriminated against. And we just kind of have people check the box. But those sort of things are really important. And I think if explained properly, talking about people's safety and protections can be part of establishing safety. And I think, the ways that we engage with them, the way that we respond when they do express vulnerabilities or share things with us, all of those are ways that we can, promote safety in our programs. And so I think that's another important question to be asking ourselves is, what can I do to help this person feel safe when they're coming into my program? This is where I will pause it. We're going to take a 5-minute break, and I'll just touch on this slide very quickly, and then we'll get into our 5-minute break. But the question 4 is, how do I best respond? And so this is sort of like a summary or wrap-up of everything that's happening. So, your response is going to be most effective if it's informed by both what you're feeling, what that person's feeling, and what's happening in the environment around you. And so, when we are responding, we want to kind of feel as much as possible like we can sort of interrupt our sense of panic. We don't want to let our panic become a problem in that situation. And so thinking about things we can do to sort of keep ourselves grounded in the moment so that we can best respond. I think things like, positive self-talk, like saying like, hey, I've got this, I'm going to be able to help this person. Or even, kind of things we do in preparation, like, making sure that we're feeling comfortable when we're at work. And that can be things we do with our own office or our own space that help us feel equipped to respond in these situations. So I'm going to pause us there for now. We'll take a 5-minute break. I'll just pass it back off to Karina for a second and see if she had any quick notes or points before we take our break.
Oh, I'm sorry, James. I was talking and I had it on mute. I don't have any other comments. You're doing a great job. If everyone can be back at around 11:08, that would be awesome. Thank you. Welcome back, everyone. James, are you ready to get started again?
Yep, I'm here.
Okay.
Okay. Welcome back. Hope everyone had a good little break. Okay. So we're going to have a little bit of a movie time now. It's actually a snowy day here in Chicago. It feels, I know, for those of you who have never lived up north, you're like, wait a minute, it's snowing? It's mid-April. But yes, this is what spring looks like in Chicago. We have flowers in our yard that are covered in snow right now. But anyway, so it feels like a good day to be kind of under the covers and watching a movie. So I'm going to have a little bit of movie time as part of today's webinar. I don't know if any of you all have seen it already, but the movie Captain Phillips stars Tom Hanks, and it's about a boat captain who gets taken hostage. So he's definitely in a crisis situation. He ends up escaping the situation alive. And so what we're going to watch here is a clip from the end of the movie. I guess I should have said spoiler alert, but this movie came out 10 years ago, I think. So I think we're in the clear now. Anyway, so he makes it out of the situation alive. And following his rescue, he receives medical attention. So what we're going to watch is towards the end of the movie when he's getting medical attention. The scene is, just as kind of like a warning, there's no violent or gory imagery, but he is certainly very affected by what's happened, and there is some blood on his body and on his clothes. So you'll probably notice that as you watch the clip. And then I think I will pass it back to Karina to play the clip for us.
Yes, thank you. And just wanted to let you guys know that if you're calling in, you're not going to be able to hear the audio. You will need to use your audio from your computer and have use the speakers. Thank you.
Okay. It's a pretty powerful clip. And so how I'd like us to kind of debrief what we just watched is to think about those 4 crisis awareness questions that we've been talking about. So as a starting point, what are you feeling now? And you can go ahead and respond in the chat. After watching that, like, how do you feel? Someone says stressed, increased anxiety and heart rate. Feel concern for this person. You feel emotional, kind of empathizing with the trauma he's been through, overwhelmed. Yeah, anxious. I mean, I think just seeing some of these words, I feel like, I'm like, this makes sense. You're all good counselors. Like, you would feel these things, right? That, right, here's a person who, even though he's ostensibly safe now and doesn't seem to have any, major injuries to him, he's clearly very, affected, and that has an impact. That has an impact on us, right? That anxiety that you're feeling, that kind of increased heart rate that you're feeling, all of that, I think, is sort of part of how we're responding to this person presenting in front of us with a crisis, and that we can feel sad. And that can sort of, in some ways, some of these emotions can sort of help us understand what's happening with this person, but also might impact the response that we have. So kind of stepping from there into the next question, so how do you think this person feels? Scared, yeah, definitely feels scared and overwhelmed, right? Wow, lots of people saying overwhelmed seems like how he's feeling. Scared, uncertain, looks, wow, lost. Yeah, and, I think you can almost see, like, he's reliving the moment. And I think, it's really, a testament to kind of like how strong this person's acting is, but like you can actually see, in the way that he is reacting, that it almost feels like the way he keeps getting distracted, that he's almost replaying what's happened to him in his head. And so that same way he's seeming shocked and overwhelmed and kind of scared, dissociating even, I think is a good example of some of the words we're seeing here, people sharing. That it's interesting sort of, now that someone said actually now that he's safe, he actually feels the emotions. So sort of like, when you're in the crisis itself, his emotions were sort of being held back by his need to just sort of be on edge and sort of respond to the life-threatening, the traumatic event that was ongoing. And now there's sort of this flood of emotions that's coming into him. So, there's both, and someone even said relief here, that it's interesting that, like, even though he's really sad, that there does seem to be some relief, right? So he asks about his family, and he asks if they're okay, or if they know he's okay. And he starts sobbing when he hears that they know he's okay. And so, yeah, there's definitely a lot of really complex emotions happening here. So someone's chiming in about the environment. The environment is neutral and safe is how they describe it. So question 3, how is the environment here? What else did you all notice about the environment? Yeah, safe and calm. Yeah, so it's a safe haven. Yeah, I mean, I think what I see in this space is, obviously you're on like a boat and a ship, and it's, someone just said not too many people. I think that's a really great point, right? There's not a lot of people, right? Someone said clinical. Even though it's a clinical space, there's not a lot of people coming and going. There's not a lot of traffic, right? It's calm because there's 2 other people in the room, I think, and that's it, right? It's not a high traffic area. There's not a lot of loud sounds going on. The only sound that you really hear, other than the two people who are talking most of the time, is the soundtrack for the movie. But there's not buzzers and beepers going off. There's, so it tends to feel calm for that reason. And then the last thing, the question is, how do I best respond? But what do you feel like the helper is doing in this situation to respond in an effective way? So someone says, clear and consistent tone, reassurance of professional care, and offering reassurance. She's literally saying to him as she's reassuring him, you're safe now. You're safe now, right? She's actually using those words to help the person feel safe. Calm, careful attention to both physical and emotional needs. I definitely see that, right? She keeps talking, and in a way, her way of engaging with this person actually helps him feel more connected to the present moment. And I think you can see all of that, right? She's asking for eye contact. She's asking kind of straight to the point questions, right? She starts from a place of saying, like, can you tell me what happened? It's a really broad question, and he seems really overwhelmed by it. But then she starts asking more simple questions, like, does this hurt? She's explaining what she's doing, right? I'm going to put this thing on your finger to make sure your blood pressure is okay, right? She's kind of both being really reassuring, but also even though she's moving quickly, she's still taking moments to explain what she's doing. So yes, I think, you all sort of see some of those really effective things that she's employing here. And so there, I think, is a really good example of kind of navigating a crisis. And, as you see with, I think, what the helper in this situation, the healthcare provider in this situation does so well is that she's remaining neutral and unemotional, which is really impressive. When we think of, us just watching that movie clip, we were describing feeling anxious and overwhelmed and sad ourselves. And I got to imagine this healthcare provider probably felt some of those same things in that situation. But it's not necessarily going to help, the person in that situation if we show all of those emotions, right? If she starts crying when he's crying, if she starts hyperventilating when he's hyperventilating. So finding a way to both, when I watch that, I see that she's concerned for him, but she also doesn't seem flooded with emotions and overwhelmed by it. And I think that's a really challenging balance to strike in a crisis situation. So yeah, thank you so much for the comments there and for weighing in. And yeah, I think sometimes, someone else will mention in here, I think this is helpful, the idea of repetition to be reassuring. And also the other thing you see here is understanding that things can be difficult when someone's traumatized. So I think you're seeing both validation, but also repetition. And I know that can be helpful for some people as well. In a crisis situation is to be consistent with what we're telling people. All right, thank you for, indulging me with movie time. So we'll get back to kind of how do we best respond. So I don't like this acronym as much as the HALT acronym, because the HALT one I think is a little easier to remember, but ALGE Action Plan comes from Mental Health First Aid. For those of you who haven't done mental health first aid training, I think this is a really great accompaniment to people who are working in substance use, because mental health and mental illness might not be the exclusive focus of the work that you're doing on a regular basis, but it's certainly an important component of the work that you're doing. So I think as far as continuing education opportunities go, mental health first aid, great thing to participate in. And so one of the things that I pulled from mental health first aid is this ALGE Action Plan. And I think this just gives like a nice broad overview of some of the things that we're trying to do in a crisis situation. So primarily we're assessing for the risk of suicide and harm. So is there a risk of serious harm here, either to self or others? But then beyond there, what we really want to do is we want to listen to the person, give reassurance, and encourage appropriate supports of help, whether that's professional help or self-help or other coping strategies. And so I think you can actually see all of that play out in the response to Captain Phillips in that clip. Is you hear that the person is very much connected to them, listening. She starts with the assessment for serious harm. She's listening closely. She's reassuring him regularly and encouraging strategies to help. So one is like her professional help, but also you're seeing her say things like, take a deep breath. Like she's encouraging something that's actually a self-help strategy in that moment as well. And so I think maybe you won't remember the ALGE acronym, but I think these are sort of some of the basic things of what we're trying to do when we're responding to people. Listen, reassure, and encourage appropriate supports. I think also important to come back to our nonverbal listening in this moment as well. What are we doing? And especially, when someone is escalated, whether they're, extremely sad or anxious, or if they're really angry, in all these different ways, what are we saying to this person without actually using any words? Because like we said before, even if you're not speaking in that moment, you're probably communicating something to that person as they're engaging with you in a crisis moment. And so it might be, are you giving them undivided attention? And I think that's like a really important element, right? Are you facing towards them? Are you giving them solid eye contact? Is your body oriented towards them? Do you seem distracted in some other way? Do you seem tense or worried, or do you seem calm? And then I think sort of something for us to think about is, how do I show this person that I'm calm? And I think probably most of us have had the experience of being in a tense moment with a client and needing to show that we're calm, but not necessarily feeling that way on the inside. And I think that's like an important skill for us to have and to develop. So yes, thinking about our own nonverbal cues, I think, is really important. And again, I mentioned silence before, but I think coming back to the idea of silence, like knowing when to be quiet, to allow a person to really just like work through something out loud before we start jumping in and trying to redirect a conversation in some sort of way. Some of the things when we are speaking to keep in mind are paraverbal communication, so tone, volume, cadence. These all kind of come back to, not necessarily the words that we're using, but how we're using them. And so again, something people picked up on a lot with the Captain Phillips clip is, she's really calm. And I think part of the way that she expresses that calm is she's not talking, she's moving quickly, but she's not talking so quickly she can't be understood. She kind of slows things down. She speaks at a good volume. And communicates well. So I think some of these things are also things to be mindful of. And I think one of the ways that we can actually, talking about like the preparation before the crisis moment is, whether it's in preparation or in debriefing, to sort of notice the way that we talk about a crisis situation when it's not going on, right? So when we are debriefing or talking about a crisis that's happened in the past, do we notice ourselves like getting really elevated, that our volume gets louder, or that all of a sudden, we're talking really fast, and just recounting it ends up with us kind of alternating our paraverbal communication strategies. It's so funny. I feel like I can't go through a full webinar without talking a little bit about motivational interviewing. So for those of you who maybe have been to other trainings that my wife and I have done, we love doing motivational interviewing trainings and talking about motivational interviewing. So just a little taste of motivational interviewing in here now. Some of you may be familiar with the elicit, provide, elicit framework. And I think this is actually a really useful tool to implement when you're in a crisis situation. And so elicit, provide, elicit is about kind of an MI adherent way of actually providing someone information. And so we can think about this in a couple different ways, but I think, the general framework is we're going to start by asking a question. So basically getting that person's input before we say anything. Then we're going to provide some type of information, and then we're going to ask a question again, either to sort of get their response to our suggestion or to the information that we're providing, getting their interpretation of it, that sort of thing. So a couple quick examples. So we talked about doing crisis planning, and one thing we might say to people are, what are some of the things that help you when you're feeling stressed out? And so that's a nice, open question, and that's sort of, I think goes along with in here, asking about prior knowledge and getting their experience. So they might tell us, oh, I like to go for walks, or I like to, I like to, whatever it might be. I like to, watch TV or just like walk away from the situation. Those might be some of the strategies I do when I'm feeling stressed out or upset with someone. And we might say, those are all really important coping mechanisms. It sounds like, right? So we're supporting kind of their autonomy and their awareness of themselves. Those all sound like really helpful strategies. And then you might even say, like, you know, could I offer, so this is where you get permission, could I offer a couple other suggestions, or could I offer you some information about some of the strategies we make available to people here? Or you might just kind of go into it and say, like, you know, here at our program, in addition to like the outpatient counseling we offer people, we also offer inpatient counseling. We also have like a peer recovery specialist. We also have an outreach worker who's kind of available to sort of meet you in the community and, you know, sometimes just like give you something to do so you can get away from, you know, whatever's bothering you. You know, what of those strategies do you think might be most interesting to you? So that last question at the end would be eliciting back. So I've already provided the information about maybe the services we offer, and now I'm going to ask back kind of your opinion about those strategies. I think in more of an escalated situation, what elicit, provide, elicit looks like is first getting permission. So someone might be, you know, really angry and kind of shouting and getting really upset in a program. And first to get permission would look like maybe saying something like, hey, can I talk to you for a quick second, right? Not an open-ended question, a yes, no, like, hey, can I talk to you for a second? They say, fine. And I say, I really want to be able to help you. This is me providing information. I really want to be able to help you. And when you are, you know, raising your voice and when you're screaming in here, it really makes both the staff and the other people here feel really uncomfortable and unsafe. And it's really important to me that we keep this as a safe space for everybody who comes here. So if you can lower your volume now, we can definitely talk about what's upsetting you. And if not, I'd be happy to talk to you about this tomorrow. What do you think you'd like to do? Right, so that's me eliciting back, you know, and in the same way, I'm still sort of offering options to the person, but sort of eliciting out, you know, what they think. Or I might say something like, you know, how can I help you manage what's going on to make sure you can stay here for the rest of group, right? You know, if you're yelling at people, if you're threatening people, we really can't have you in here. What can I do to help you manage what's happening for you right now? And again, this is where the work on the front end is really important. You know, you can't necessarily have that conversation with somebody if you don't have an existing relationship with them. And I think the other thing there is, you know, tone is really important here also. You know, if I'm talking to somebody and I'm saying like, you know, what can I do to help you manage this situation? Sure, like the words might make a difference, but I think even the tone could come across as condescending or insulting if I'm not careful, or if I don't have that relationship with someone. So being very careful about how we kind of approach and phrase those types of things and how we sound when we're making those questions or statements to people. Okay, there's elicit, provide, elicit. Here's a quote I like. The secret of crisis management is not good versus bad. It's about preventing the bad from getting worse. You know, when I put these slides together a little over a month ago, we weren't all on, you know, stay-at-home orders and lockdowns and all that sort of stuff. But I think, you know, whether you're talking about that, like at the time I was thinking about hurricanes. I actually grew up in South Florida. So I've been through my share of hurricanes. But I think, you know, whether you're talking about a hurricane or a coronavirus, you know, one of the important strategies that you have for both of them is stay inside, right? You know, when you think you see the eye of the storm, like you don't go out and like go and like walk around, and you stay away from downtown, right? So a lot of the things we do in those types of crises, you know, limiting exposure to other people, covering our mouth, washing hands regularly, a lot of that is about preventing that crisis from going from bad to worse. And so I think that same thing applies when we're dealing with a crisis management, right? And that's not to say that like when someone's in crisis, you should go home and stay inside and not come out. That's not what I'm getting at here. But more so, you know, what is it that our response is doing, and how do we make sure that, you know, whatever our response might be in that moment, that it's not actually making things get any worse than they already are. So I think a couple points here. One of the things that I think is really important for crisis management is when someone is escalated or really upset, that we're providing physical space and time. And so, you know, when someone feels boxed in or crowded by us, that can actually increase the stress of the moment and make things get worse, right? And And so the other thing is time, and I think this can be a real challenge when we're on such tight schedules, especially, you know, someone comes to us between groups or during the break on groups, and so we feel obligated to, you know, we have split responsibilities, right? I need to attend to this person who seems to be presenting right in front of me in crisis, and I also need to restart the group. And so I think, you know, being able to lean on teammates can be helpful in that time, because we really want to be able to make enough space time-wise for that person to be able to express what's going on with them. Because if we just sort of, you know, rush them along and say, hey, you know, this sounds really important, well, we got to get back to group, I think that can make someone feel really unheard and just not very well supported. But so giving people that space and time helps people feel calm and feel like you are a safe person to be connecting with. And then again, going back to the environment and that idea of caution is you want to be aware of what's going on. You want to be kind of keeping an eye on the situation, both on what's happening around you and on the exits. And then I mentioned here, like if you're in a car, pull over. I know for one of the treatment programs that I was at, we had outreach workers that would go. They were community health workers that would go and they would like transport people for treatment or for appointments that they might have. And so I think, you know, if you have any folks who are doing outreach or transporting your participants, that's something to keep in mind is, you know, if a person is becoming threatening or at risk of, you know, threatening or harming themselves, that you want to like pull over. I think the car being in motion itself can make things feel really stressful at times and actually increases the risks or the dangers in that moment. This is something, nonviolent crisis intervention is another form of, another like kind of training model that you can receive. It's another evidence-based practice. So I just pulled a little part from it, and someone who does training, Michael Summers, who does CPI training. So what you see here in the image, the CPI supportive stance. So the staff member is standing at, you know, a respectable distance. So, you know, she's got, this person doesn't look that angry because they're just wagging a finger, but assume that person is very upset. So they're standing there, they're really upset, they're shouting, but the staff member is both able to, using this supportive stance, show that they're engaged and connected, right? They're offering their eye contact, they're oriented towards them generally, but they're also giving the person enough space. So this is what this actually physically looks like. Is she's more than arm's length apart, and she's also got her body oriented slightly to the side. And that provides an additional level of safety in the sense that if that person came towards her, she'd be able to kind of shield herself with the side of her body. Now, obviously, we're not, you know, for those of you who've done the work for a long time, the idea of, you know, someone trying to physically harm you is rare and not very common, fortunately. That being said, this supportive stance does put you in a position where you're actually going to, you know, have the safety should you need it, right? And same thing, not only in terms of protecting yourself, but also in terms of exiting the situation more easily. So the quote here, though, that I really like is, the best use of restraint isn't physical. It's restraining ourselves from reacting instinctively and instead learning how to talk to people. You know, as much as possible, we want to resist restraint. And I feel like when it comes to crisis situations, restraint is something that we think a lot about, but I think as much as possible, we want to avoid it. You know, if we're in a situation and we're considering restraining someone, that's actually a situation that has probably gone too far already, and that we really want to, as much as possible, try to help people calm down by using our words. Certainly, trying to hold someone down runs a very serious risk of re-traumatization. I think it's very unlikely to make someone feel safe if you're restraining someone, and even if you know, the client isn't the one being restrained themselves, if they see staff putting their hands on someone else, I think there's just a whole can of worms that we're opening up if we get into any kind of restraint. And so I think more important, you know, what a lot of like nonviolent crisis intervention teaches is less about restraint, like safe restraint, and much more about breaking holds. So if a client did put their hand on you, how to effectively like pull away from them. And so I actually had one time a client essentially like try to put me into a headlock. Again, like I said, very rare these things, so I don't mean to cause any alarms. but the client basically like put his hands around like my chest and around my neck, and without pushing against the client or anything like that, all I had to do was I lifted my arms in the air and I turned, which is something that like nonviolent crisis intervention teaches you, and I was able to like move away from the person. I walked away from that person and another staff member started engaging with them instead. And so I think that's another example of where having a team is really helpful. And there was a supervisor present who was basically like, hey, you should step away from the situation now. This is a good moment to take a break. So yeah, and then again, I think, so someone mentioned here, it depends on what is your job. So I think I'm working from the assumption that most of you all here are counselors. And so I think as counselors, that's sort of what I was thinking of, but I don't know if that person wants to say a little bit more about how your job might impact sort of whether or not you're using restraint or avoiding restraint or what that looks like. Mobile crisis services, okay. So yeah, I mean, like, so for me, when I think of mobile crisis services, I guess I think of a couple things. But one, if you're going out to the scene where a crisis is happening, in particular in those situations, as a social worker, counselor in that situation, I would want to avoid any kind of restraint and hopefully, rely on being able to like calm people down and talk to them. I think the other thing I think of is sort of like transporting people. And so I'll just mention real quick, I did see a question earlier asking about sort of a reluctance to, and that person just said we don't do restraint, which is great. But someone was saying, a reluctance to call police for hospitalization. And I will say, if possible, this is why having things like mobile crisis teams, outreach workers, people who are able to transport clients is really helpful, is if you have someone who will agree to go to a hospital but might be really resistant to the idea of police, having a staff member transport them, I think is really helpful. Okay. A couple of de-escalation strategies that we'll just mention here. So overall, the goal of de-escalation is to reduce the intensity of a heated conflict. And I think so important here, it takes time, but it will happen. And I find that this is something that actually helps me stay calm in really stressful situations is no matter how angry or upset somebody is, that will pass. It will not, and especially when people are angry, they can't, like our bodies, people run out of fuel, you can't stay angry forever. And so that's why listening, and you see here active listening, validation, and humility, that's why listening is just such an important strategy, because when you feel understood, it makes it really hard to stay upset, right? When someone is coming at you and they are, yelling and screaming, and you are able to respond by saying like, yeah, you're really upset that you didn't get what you need from this counselor. You're really upset that this program's not meeting your need. You're really upset that the probation officer isn't really cutting you any slack here. All of a sudden, that anger kind of is dissipated by the fact that they feel like they, first off, are being understood and validated, but also that they feel like they have a partner. So I think partnership is so important here. And when I say humility, the other thing that I think is really important is, being able to account for mistakes that happen. And, you may not have been the counselor that did this person wrong, but if this person perceives like your program has done something to harm them or has not met their needs in some way, being able to just say, I'm really sorry that you're not getting what you need right now from our program. And so I think that's sort of what I mean when I say humility, is the ability to acknowledge mistakes. And I think in that way, I consider humility and apologizing and owning our mistakes to be a very trauma-informed behavior, because it's certainly something that someone who perpetrates traumatic events has not actually done to that person. Couple of notes about crisis management when it comes to sort of like agitation. So this is one level of working with people. So one thing, we talked about the environment, moving away from crowds and audience can help sort of dissipate the agitation that might be developing. Focusing on the nonverbal skills, so especially when people are upset, we want to focus on how do I show this person that I'm listening, that I'm concerned, but that I'm not kind of freaked out or upset about what's happening, or that I'm not judging them for being annoyed and ticked off in this situation. normalizing and validating feelings is sort of what I was just talking about a moment ago, but basically saying, like, I get why you're upset, and this makes a lot of sense. Responding when appropriate, asking respectful, open-ended questions, and then getting their input about solutions and coping strategies. So, we're not trying to, certainly we don't want to be interrupting people when they're agitated or when they're upset and trying to express something to us. Like, so in some ways it's just, I think when people are agitated, it might just be that they need to just get it off their chest. And the best thing we can do is to sort of be aware of how we are non-verbally communicating. And I think I mentioned the idea of minimal encouragers before, those yeah, like that might be enough for that person in that moment to show that we're engaged and that we're listening and that we're understanding and we're getting what they're saying and what they're sharing with us. The other thing I will say is, you see here, like, normalizing and validating and asking open-ended questions, getting input. So a lot of this is about more like getting that person's perspective as opposed to imposing our own interpretation. And so I think, especially when people are agitated, trying to argue with them or reason with them or explain to them is more likely to actually increase agitation. So we want to be really careful not to do that. We want, more than anything, we want them to feel heard. So say things like, what's going on for you today? What do you think you'd like to do? Or what's been helpful when this has come up in the past? Those types of questions about coping strategies and understanding the situation are going to be a lot more useful when someone's feeling agitated. When someone's like agitated, I think these are some other strategies that I think that can also be helpful. So applying coping skills. So just a couple ones that are in here. I mean, I think, going outside, taking a walk, having something to write, color, or draw. And these are things that, again, we might introduce these. So like I know several of these I introduced to people during just like regular group practice. So I think, again, striking while the iron's cold. I think that's the last time I'll say that today. But striking while the iron's cold, like helping people familiarize themselves with some of these coping skills in advance can be helpful. But I think in the moment also, sometimes this can be enough to just sort of like introduce. So when someone's feeling really agitated, we might say, hey, can we just like step outside and like take a breath? We'll go for a little walk for a few minutes and clear our heads, right? So it's offering up that suggestion like that. Distraction skills. So, tell me about, and it might be like, tell me about a time where, things were less stressful in your life, right? And just sort of putting your mind on something else. So especially when people are feeling really stressed out in that moment, putting your mind on something else. Some of the other grounding techniques. So progressive muscle relaxation, I think the word got cut off there, but progressive muscle relaxation and is basically, putting our attention on our muscles. So you actually focusing your attention on your body and tensing a part of your muscles and then relaxing it. And so I think this is actually helpful because sometimes without realizing it, and this is where self-awareness comes in, we might actually be tensing our muscles in a situation without noticing. And so progressive muscle relaxation actually gives us a subtle way to sort of take control over the tensing of our muscles. And this is sort of something subtle that I think counselors themselves can do to sort of try to maintain a sense of calm. Someone said, this is interesting. Someone mentioned that they use the technique of actually whispering a person. So lowering your volume so much when someone's upset or angry with you, and it actually catches them off guard and that they have to reorient. And I think it's interesting, like part of why we use a calm tone is to keep people, instead of matching people's like loud volume, we want them to sort of match to our calm tone. The last one I'll just mention on here, so 5, 4, 3, 2, 1, checking your senses. So we might say to someone, what are 5 things you see in the room? What are 4 things you can feel right now? The chair, the cool air, whatever it might be. 3 things you hear, 2 things you smell, and 1 thing you taste. And I really like these grounding techniques that engage your senses because when you choose to pay attention to certain things, that can definitely affect your mood. So putting focused attention on something can change your mood, really. And I think sensory things are especially effective because it's hard to be grounded in all 5 of your senses and then also be caught up in something else, you know? I know, like, when I did this with someone, they talked about how, you know, just the hearing thing was the one that surprised them. They were like, you know, there's all these things that are happening around us all the time. Like, these sounds are always there, but I never really noticed them. And so when you stop yourself for a moment and you put your attention on those things, it can actually help you feel more connected to the present moment and kind of pull you away from some of the other thoughts or feelings that are sort of hijacking you at that time. And then I think the kind of, actually, I'll just mention here, I think that, you know, this sort of thing can also be, introduced. So sometimes it can feel a little bit awkward introducing some of these strategies, like playing catch with someone. And I think the elicit, provide, elicit framework is also helpful here. Like, hey, would it be okay if we did something to just sort of change it up for a minute? And that's like a nice elicit. And people might say yes. And be like, okay, I have this like stress ball. I just want to like toss it back and forth for a few minutes. Or can you tell me 5 things that you see in the room? Like, tell me 5 things you see in the room right now. That would be the provide, right? And then kind of working through that. And then once you go through this activity, then the elicit again would be saying something like, how do you feel now? You know, asking people kind of like, you know, how was that for you? Those types of things. So I think with all of this, all of these different activities or coping skills that, you know, whether you use the elicit, provide, elicit framework or not, doing that debrief with people afterwards is really essential, right? So asking people like, so, you know, you were feeling this way, we did this activity, like, how do you feel now? And helping people sort of name, hopefully, that using a coping skill like that was actually particularly helpful for them. And I know, you know, things like playing catch, it seems so simple, but there's something really subconscious about the fact of connecting with someone. And sometimes when we find it hard to connect to people using our words, connecting using a physical activity like playing catch instead actually helps us establish that same sense of connection with a person. So next, I'll just mention here, so, you know, when people are feeling aggressive, so moving beyond agitation to the place of aggression, you want to keep doing what you're doing, kind of still setting limits, making sure people are aware of, you know, what they are and are not allowed to do, but also providing choices. So I think I provided an example before of, you know, like, if you are able to like lower your volume and not make threats towards people, then we can definitely keep you here in group for the rest of the day, those types of things. In general, you know, when someone moves to the point of aggression, this is where we want to start using more closed-ended questions. You know, those big, broad, open questions are not going to be as effective when someone's really aggressive and like kind of all over the place. So we want to like, you know, simplify in that moment. And then, you know, do you want to talk now or should I come back later? Right? Those are like two, that's like a 2-option, it's almost like a yes or no question, like now or later is like a nice closed-ended question you could ask someone. And then, you know, I would say when someone is at the point of aggression, we want to be really mindful because sometimes responding when someone is aggressive is going to be very limited in terms of how helpful it can be. In terms of like having your cell phone available, being prepared to call for help, it might be that you're prepared to call a supervisor for additional support, and then also leaving if asked to do so. I think I have another quick couple notes about that. You know, when to leave, it's a couple points about this. Just if a person is asking you to leave, like, and they might just say something like, get out of my face, leave me alone, walk away, right? You don't, especially if someone's like at the point of aggression and really a heightened state, you don't need to sort of like insist that they, you know, stay and keep talking to you or that they let you help or something like that. You know, if that's, I think, a really simple example of honoring someone's autonomy in the moment is if they're using what they're showing you on the surface is they want you to get away, like honor and respect that. But I think also like if a person is brandishing a weapon, becoming violent or threatening, other people posing a threat, in all those situations, just walk away from those. And again, as a counselor, as a social worker, a therapist, it's not your job to disarm someone. We can feel really pulled into that moment and like we need to respond in some sort of intense way, but there are limitations. Like our job is to try to talk to people and to calm them down. So here's a couple of notes about calling 911, which we've mentioned a couple of these already, but really should be considered an absolute last resort. And I think when there's an imminent threat of harm to self or others, and I think even still, like, sort of being transparent with people about this is something that can be helpful. So, if the event is life-threatening, that's when we might call 911. But I think a couple things we can do to sort of mitigate calling 911. I know in some parts of Florida they have what's called crisis intervention teams, or a CIT officer. So these are officers that have received, I think, something like 40 additional hours of training in de-escalation and being able to recognize mental health needs. So they, in theory, should be more equipped to handle a mental health crisis or someone who's emotionally escalated. So, if you are calling 911, especially if you need to hospitalize someone, really important to ask for a CIT officer if they're available. And when you're talking to the officer will arrive, and usually they'll ask for who called or who will be in charge. And you want to explain the situation to the officer and also give them space to work. And then the other thing I was saying just about sort of kind of signposting for people is making sure, one thing you can do to sort of mitigate is talk to the person who you called for help for, and just let them know, hey, there's some officers here, and they're going to come in a minute, and they're going to talk with us. And I want you to know, we're really just concerned about your safety and your well-being. Or we might say, they're planning on taking you to the hospital to make sure that you get assessed to see if it's best for you to be there right now. We're only calling because we think that might be the safest place for you right now, and we're really concerned about you. So kind of letting people know what we're doing and why we're doing it, I think, can also help them feel a little bit more aware and connected in that moment. Some final kind of do's and don'ts to de-escalation. We've touched on some of these already, but keeping calm because affect is contagious. I just really like that phrasing of it, that affect is contagious. Taking away the audience, being patient, listening to the person, and as much as possible, find a way to give the person options, even if that option is talk now or talk later, something like that. Don't push back on people. Don't tell people what don't invalidate their feelings. Don't say, you really shouldn't be that upset about that, or say you'll get over this, right? Those kind of things are more likely to escalate that person. Certainly avoiding physical contact or getting too close to people, threatening or ignoring them altogether, and then arguments. All of that stuff is just going to kind of make it even worse. And so I think being realistic and honest and transparent about what you can and can't do for them in that situation is sort of the most information that you can provide, and otherwise really just finding ways to listen to the person. When people are overwhelmed by big emotions, it's our job to share our calm and not join their chaos. I like that expression. I think it does a really good job of summarizing part of what we're doing when we're engaged in crisis management. So for crisis recovery, you want to wait until the person's at baseline. This does not mean, 5 to 10 minutes later or even after group. You might want to come back to it the next day. Again, this goes, I said I wasn't going to do it, but one more time, striking while the iron's cold. But coming back to it when the situation is sort of totally dissipated. And so I think that's, an important part of the debrief is finding a safe time to engage in the debrief. You want to process sort of, and similar to what we talked about before with debrief, you want to talk to them about what happened, both kind of being aware of what happened, how it was responded to, how it went, and how it could have gone differently, and sort of making sure as a part of that you're identifying that maintaining that relationship and their connection to both supports at the treatment program, but also their counselors at the program is a really important part of that. And letting them know, we want to keep you here. We really think that this is a good opportunity for you. This is the kind of place where you can provide some help. Reestablishing that connection after a traumatic event is something that really reduces the impact of the event for everyone involved. And we started from a place of talking about the mental health impact on counselors when they're engaged in a crisis situation. Feeling like you reconnect with the people with your coworkers, with the clients involved, are all things that can sort of help mitigate the mental health impact of a crisis situation. So I will say this is probably a terrible acronym, but escape it's a long one. But I think these are all kind of key things to do when you're doing a conversation with someone afterwards. So making sure you have separate space to have this conversation, getting that person's perspective on things, summarizing how they felt about it, connecting what they were feeling with how they responded, talk about how else they could have responded in that situation, making a plan, and then bringing and integrating that person back into the program. So I think, like as an example, I might say to someone like, hey, I want to touch base with you about what happened last week when you were in group. Can you help me understand kind of what was going on for you? We might say, it sounds like you felt really angry and ignored, by the counselors and by the other group members. And when you were angry, you got so upset that you ended up throwing a chair across the room and storming out. And it makes sense that you were angry, right? No one likes not being listened to. But it also seems like you don't feel great about how you handled that afterward. Or you might say, like, what are some other ways that you might have handled that your anger, or what are some other ways you could do this in the future? And we kind of, talk about here maybe like why it's important that we establish a safe space for everyone who comes here, and that throwing chairs or storming out of rooms doesn't actually help people feel like this is a place they can be heard. So, what else can you do to manage that situation? And you might say, like, one option is to, try talking to someone, pulling someone aside during the break to have a separate conversation. And what sort of things might you say? And you plan for how this conversation might go. And then afterwards, thanks for talking with me about that. I appreciate your openness. Glad we're working together. And, I'm happy to be here for a support for you. There's with some of that language, I think that might be helpful in those situations. When we're working as a group, I think it's important that we do debrief not only with the individual involved, but as a team. So we want to evaluate and assess first with ourselves, kind of checking in with ourselves, bringing that self-awareness in and understanding how we're feeling, talking with our teammates then about like, what happened, how did it go down, what else is are people's needs around this situation, and then, what did we do, what went well, what could we have done differently, and then how can we maybe integrate this moving forward? All different kinds of questions we might ask ourselves as we debrief a crisis. So it's the end of our time. So I will leave you with just a thought and kind of a question maybe for you to think about as you move forward. So, what would you say, looking back at some of this material, what is, one of your biggest takeaways, and what's something you feel like you can try out or maybe introduce to your team when you get back to work? And then I think in addition to that, one thing you can do to take care of yourself today. Like I said, we are all dealing with very full cups right now for one reason or another, all having to make a lot of adjustments to our lives. And so it's important that we think about what are the things that we can do to feel good, to help take some of that water out of our cup, to feel well prepared to continue providing support. So I'll leave you with that thought, and, if it's helpful to like write down some of your thoughts. Someone mentioned, they're pre-planning for as many aspects of a potential crisis. So pre-planning being maybe something that they want to take away. Thanks for that comment. Just a couple of resources and references. So I like to talk through these so it's included in the recording, but the National Suicide Prevention Lifeline, the Crisis Text Line. I think it's so great that more and more of these resources are becoming available. Florida's Child Abuse Hotline, and then the Trevor Lifeline, which is specific to LGBTQ youth. So for those of you working with young adults and dealing with sexual identity or sexual orientation questions. Someone else said, their biggest takeaway was relating to the fact that people have different, oops, I lost the comment, different mediums, and therefore someone's suicidal ideation may look different than someone else's, right? So someone who, understanding that people's baselines can make a big difference in what a crisis actually looks like for them. That's great, thank you. A couple of the resources, so mental health first aid I mentioned on here, the Motivational Interviewing Network of Trainers. Those who are interested in getting more motivational interviewing, I obviously think you can never have enough motivational interviewing. And And then a couple other things, some resources from SAMHSA, in particular about trauma-informed care. I mentioned Matt Bennett, so this is his blog where you can get the full article on the cup analogy and self-care. You'll also find links to his podcast on there, which I think is really helpful. Some additional resources that are about therapeutic crisis intervention, about trauma, and about motivational interviewing are the other things you'll see in here. Oh, and there's the link to, or the reference for trauma stewardship. And I think we'll leave it there with any questions and comments that people might have. Take a few minutes here if anyone has any additional questions or comments. Someone else said they appreciated the tips about what to do if you have to call police in a crisis. Yeah, hopefully we don't have to face that situation, but I think we know sometimes those sorts of things do come up. The safety preparation questions in your assessments being another option. Yeah, I think, yeah, that pre-work that you can do, and like I said, I think that's also really helpful for relapse prevention strategies, right? That crisis preparation is relapse prevention. I see a lot of thank yous. No additional questions for right now, though. There will be a copy of the PowerPoint available to folks. I think someone asked about that, I think, as well as a recording.
Yes, thank you so much, James. You did a great job, and we had a lot of great comments and responses. We will have the recording and the PowerPoint available on our site within 30 days. And again, thank you, James. And if everybody could stand by for a couple minutes while I go over some items of business about your CEUs.
Oh, Karina, sorry, Karina, can I just real quick? So I did see one question.
Sure.
That came in. So someone asked about, you know, how do you solve when you kind of have like a toxic work environment that's actually adding stress to crises, and that might actually run the risk of re-traumatization for some of the clients that you're serving. I think that's obviously a really challenging situation, but I do just want to sort of acknowledge, as much as possible, trying to find opportunities to control what space we have. And I think this is actually one of the benefits of doing therapy and counseling is, whether you're doing groups or individual, you really do, as a counselor, have a lot of freedom to control your space in your environment and to make that time that you have with your clients as therapeutic and as valuable and as safe as possible. So I think just being really attentive to what elements of your program you do have control over. And then, you know, when it comes to trying to help improve the environment as a whole for people, because obviously, you know, you are not the only person or the only part of your program that people are engaging with. I think focusing on really concrete things, and just like we would encourage our own clients to do, to say, you know, this element of our work environment makes me feel, you know, stressed out. And I'm worried that this is having an effect on our clients, and trying to come with a concrete suggestion. And instead of focusing on, you know, all the broad things that could change about the program, trying to focus on one thing, right? So I think it would be really helpful if, in a crisis situation, you know, we always made a point of debriefing as a team afterwards. You know, just trying to take one element of this crisis management and hopefully be able to like introduce that, because I think sometimes when you come with a laundry list, that can kind of feel overwhelming to the people that you're bringing that feedback to, and instead trying to sort of limit and bring it in small pieces. Sorry, okay, I think that was the only other question that I saw. Thanks so much.
Thank you again. We appreciate it. And if everyone could please stand by, I'm going to go over a couple things regarding your CEUs. When I conclude today's webinar, your browser will take you to an evaluation on FADA's new website. If you want to receive CE credits or a statement of credit for this event, please complete the evaluation. You'll be prompted to register or sign in to complete the evaluation. You can register as a visitor at no cost. For CEs to be reported to CE Broker for Florida licensed healthcare practitioners, you must provide an accurate Florida Department of Health license prefix and number for the first time you register. After you register or sign in, you will be directed onward to the evaluation. You may consider using the same email address when you register for webinars through our WebEx link and when you set up your profile in FADA's system. This helps us connect your attendance and your profile. You will get a second opportunity to complete the evaluation through a follow-up email later today in about 30 minutes. The sender will be Messenger at WebEx. The evaluation will close at midnight on Tuesday, April the 21st. We do not email statements of credit. Instead, after we verify attendance and completion of the evaluation, a statement of credit will be generated as a journal entry within your profile. We thank you for participating in today's webinar, and we'd also like to recognize and thank especially the Florida Department of Children and Families Office of Substance Abuse and Mental Health for funding today's education. Have a great rest of your day, and please hold for the evaluation. Thank you.